Good evening, everyone. Welcome back to our Life in Motion monthly webinar series. I'm Caitlin, and joining us tonight is Dr. Abrams. A little about Dr. Abrams. He earned his bachelor's degree of science in chemistry at the University of Pittsburgh and attended UT Health Science Center here in Memphis for medical school. He completed his surgical internship through the Joint Civilian Military Program at Miami Valley Hospital, which is affiliated with Wright State University's Department of Surgery in Dayton, Ohio. Afterwards, he transitioned to enhance his leadership and clinical skills as a combat search and rescue medical director and flight surgeon in the United States Air Force at Nellis Air Force Base. Following these experiences, Dr. Abrams completed a residency in physical medicine and rehabilitation at Johns Hopkins Hospital in Baltimore, Maryland, which was followed by a fellowship in pain medicine at Milton S. Hershey Medical Center at Penn State Health. Dr. Abrams is committed to enhancing individuals' quality of life through a comprehensive, patient-centered approach that begins with the initial visit. This evening, we'll be discussing how to maximize your visit with a spine doctor. This is what your doctor and your insurance company expect you to know. We'll explore several topics tonight, so feel free to submit your questions in the comments throughout the webinar. I'll review them and relay them to Dr. Abrams as we go along. Abrams for joining. Thank you for being here. The first question I have for you on the topic is, what is your priority as a treating provider?
Well, thank you, Caitlin. My priority as a provider is to offer excellent care to the patients. So we want to figure out what is the patient's greatest complaint, figure out what's going on, how we can help the patient, and then give them a plan for recovery and maintaining improvements and regaining function.
Awesome, awesome. So diving right into their visit, what do they need to physically bring to their first appointment?
So patients, particularly for their first time seeing a doctor, particularly orthopedics or spine, it's important to have the essentials. So have your insurance card, valid driver's license and ID, and most importantly, accurate medical records. So what helps expedite the visit to get accurate diagnosis and to develop a treatment care plan is knowing who are your current primary care providers. Mm-hmm. If you have any specialty providers that you see, who they are, their phone numbers and location. It's also very important to have accurate medical history and accurate surgical history, particularly within the last 10 years. And then particularly in managing pain and spine, all medications that they're currently taking, to include what dose, why they're taking the medication is important as well, and how often they're taking that medication. Something that may also be helpful if they've seen another provider for the same issue, coming with records that we can view, mm-hmm. or having them sent ahead of time to be downloaded in our system. I think a common misconception is that all doctors have access to everyone's records, and the majority of the time in private practice settings, that's not true. And so we may not have access to any labs, x-rays, MRIs, or notes from mm-hmm. other doctors that you've seen if you didn't bring them with you, if the patient didn't bring them with them, or if did not have them sent ahead of time.
Awesome. So I feel like sometimes people say their doctor sends stuff over, but those images, they have to be brought physically to the clinic. Is that right?
That's correct. In the local area here in Memphis, there are certain facilities that we can get access to patient information, mm-hmm. but sometimes you don't have it. So generally the hospitals have independent systems. Some of the community-based practices that do x-rays and MRIs or CT scans may upload it in the system. Most of the time it goes to the ordering provider. And so if another physician ordered it, you may not be able to see it.
Gotcha, okay. For their office visit, before they get to the clinic, what are some things they can do beforehand? I know some patients want to jump right into seeing a doctor, but is there anything that they can do before their visit?
They can. So a lot of things that can help shorten time to care for patients are, one, doing some home exercises. While most insurances may require physician-guided or therapy-guided exercise, there are some valid resources through your own insurance. They have remote monitoring programs.
right, do we have sound now?
Yes.
Good, good. Sorry, we were having some power issues here. The lights were flickering, but we are back on, I believe. We got the thumbs up, perfect. So what we talked about so far is Dr. Abrams' priority when he's treating patients. Do you want to kind of recap on that?
Yeah, so where we discussed the question earlier before the technical malfunction was, when patients come in, we want to tackle the most important issue. As people get older, we typically have more chronic pain conditions, particularly in the spine. It's very rare that there's just one problem. So we try to focus on what's most bothersome, what most impacts your function, and try to improve that and then move on to other issues. So while patients may have multiple complaints and everyone would like to have everything addressed at once, you tend to have a better outcome and a more directed, focused program by targeting what's most bothersome.
Awesome.
And then adding in additional issues as one area gets better.
Perfect. And then for their visit, just to recap to what they need to bring with them, I know driver's license and insurance card when they check in, but what's important for you to know about as a provider?
So as me as a provider, what's most important when I see a new patient with a complaint of spine pain or limb pain is what previous treatments have been performed, how long you've had this pain, have you seen any other providers, have you initiated any medications or any therapies on your own, to include therapies from another physician, medications from another physician, self-guided therapy through your insurance, whether that's remote or online physical therapy, or seeing a physical therapist on your own separate from seeing the physician. And then also prescribing medications, we need to know what medicines patients are taking, what dose, how often, and particularly why they're taking that medicine.
Awesome. Okay, so jumping in now, moving to where we were. For your office visit, it's always important to arrive a little early, like 15 minutes, and to have those hard copies of the driver's license, insurance card. What else can they expect from their office visit?
Yeah, so when you come to the office visit, typically when you check in, we'll get you into a room. It's very common in spine patients, there's an intake form, but not always, which is basically the storybook. We don't want to know what's happening, how long has it been going on, where did it start, why did it start, what have you done, where do you hurt, particularly if you can describe your pain in words is very helpful, how severe your pain is and does it impact your functional quality of life. Typically, once you get in the room, the physician will come in. We usually will spend time with the patient and introduce yourself and verify why you're here. Mm-hmm. So we may say, nice to meet you, I understand you're having back and leg pain, is that correct? Typically, the next phase of the visit is gathering history. What helps things move smoothly is just having succinct, precise answers to the doctor's questions. We all want to get in and out as quick as possible. We also want to make sure that the patients feel heard. Mm-hmm. What helps move that along is answering the questions that are asked and then be allotted more time at the end to add additional information. You usually may just take a few minutes for the physician to get what he needs, and then we can offer up time for you to add any additional information. Mm-hmm. Sometimes extraneous information may delay what we need or confuse things, so the more brief and more precise the answer is usually more helpful. After the history, we usually do a physical exam. Physical exam is evaluating the area of pain and see if we can find any causes of that pain. Sometimes it may be challenging for our older patients because they may present in a wheelchair, so maybe having a family member accompany them. And then sometimes the exam may be limited due to painful conditions where you can't do an accurate exam. Mm-hmm. There's usually a component of an x-ray that's performed at that visit, and the findings of the x-ray are reviewed with the patient at that time. And then we discuss what we think is most likely going on. We may offer alternative conditions that could mimic what we think is going on. And then usually we discuss the treatment care plan and take additional questions or input from the patient and see can we agree on a path forward.
Awesome. So after you get a treatment plan and the patient decides which way they want to go with it, moving forward, why is a follow-up appointment necessary?
So follow-up after treatment is started is very important. One, it helps us make sure that the patient is getting better, that they're having appropriate treatment and the appropriate diagnosis. The other important reason for follow-ups is we can guide the patient on maintenance, meaning they've gotten better, how do we maintain the improvement without regressing? And so that may involve some sort of counseling, recommendations for further home exercises. And then lastly, medication management. Some patients are started on medications. We want to know that they're effective, they're not having side effects, and if we need to use them long term or if we need to stop them, that patients are counseled to stop them safely. The other thing is with insurance, insurances often require follow-up to verify benefit of treatment, and following up appropriately can save you further visits. So if a patient, for instance, had an injection and they had 6 months of relief, if they never followed up before we could repeat an injection, there's a lot of documentation we'd have to show that they had a home treatment program, their pain was better, their function was better, they had less need for medications. And if we didn't have any evidence of that, they may be required to repeat the cycle before repeating an injection that we know is effective.
That's good. So now that you're on the topic of insurance, can you speak a little bit on billing? What do patients need to know?
So regarding billing, that's also important, particularly in a tough economy. Sometimes people have financial restraints, sometimes they don't. But in those cases, understanding your bill is important. One, it gives you a summary of what services you were rendered and what charges you received. The billing may also show if you were responsible for a copay. And some of these things can be identified ahead of time with something called an explanation of benefits. We often call that an EOB in medicine for short. And so what the EOB is a document that shows what services were rendered and care given, what charges were filed against insurance, and what you're responsible for as the patient. In addition, these explanation of benefits give you a good summary of what your healthcare plan provides you. And so if you're familiar with this, you can look ahead of time to know if you're responsible for any copays regarding physical therapy, imaging tests, or specialty fees. It also will let you know what type of requirements such as prior therapy or medications are required if you were to pursue imaging of your back, if you wanted to pursue an injection, or even if you needed surgery. The other thing that's important with that is it helps patients and doctors navigate claims or peer-to-peers for services that we want to perform but may be denied for certain reasons.
For the EOB, how can a patient access this? Do they have to call their insurance? I know there's numbers on the back of cards.
Yeah, Caitlin, that's a good question. So several ways you can access your EOB. Number one, you could call your insurance provider number on the back of your insurance card, and they can walk you through the process, and they could email you or mail you a copy. The other alternative is to have an account with your insurance. Most insurance will allow you to make your own personal account, and typically within those accounts there is a claims claims section where you can view your own personal account and look at claims. Typically in that you'll find the explanation of benefits.
Awesome. Moving into, so once you order a treatment, I know you have to kind of give time for the clinic to send it to your insurance and get it authorized and be able to send it and get that authorization back. What happens, what's the process kind of on the clinic side if it is denied?
So typically when we order medication or a procedure, they may have to go through what's called authorization. With the exception of Medicare, most medications or procedures need authorization. Sometimes we order these medicines that may take, or procedures may take several days. So it's not always our fault as the doctor to withhold things from you, but the insurances may require review before releasing it. And that's what we call a prior authorization or pre-certification. If that is denied, there's a set of processes to combat that. One, the doctor can file what's called a peer-to-peer. A peer-to-peer is a quick, expedited conversation with another physician regarding the reason for the denial and see can we get that overturned by providing additional context or information. If that is not approved, then you can do a physician appeal, and those can be anytime within 30 to 60 days depending upon the insurance. The delay with that is insurances also have a time period to respond, and you cannot submit the appeal till you receive the official denial letter. So sometimes that may take several weeks to a month, which can cause patients to undergo further delay in treatment. And the third level is a patient appeal. A patient appeal is where the patient, and they can do this at any time, regardless of the doctor, where they submit their own documentation and information to see if they can get the denial overturned. The downside with that is if it's submitted and we don't know, it may already be in process, in which case we can't do a doctor appeal until the determination is made regarding the patient appeal.
Yeah, so they kind of fight each other, I guess, is one appeal and then the other.
And then another monkey wrench is external reviews. So insurances can do their own internal appeal, and if it's denied, it can be sent to a third party, or they may just send it to a third party who has a set of guidelines that will review. And so third party involvement sometimes may delay response to appeals as well. Gotcha.
So jumping into a few questions from from our viewers. Angela, she asked, she's a current patient of another doctor here at OrthoSouth. Do our communication within OrthoSouth, is it the same, whereas we have access to all of her medical records if they were performed here?
Yes, so any physician within OrthoSouth has access to every other physician's records. So that includes your images taken within our system, your documented medical records, any laboratories, any outside charts, all that one doctor will be able to see as long as they're part of OrthoSouth.
Awesome. Another question we have here is about how much time in the visit is allotted for the doctor to speak with the patient?
So an ideal visit, and every scenario is different, the doctor, most of the time, as I mentioned earlier, we only need 2 or 3 minutes to get the information we need. So what helps the visits move expeditiously and orderly is to do the history, do the exam, and then after exam, for me, I typically ask the patient, is there any additional information you want me to know? And so most of the time, that takes several minutes. It may be a little bit longer depending on how complex the case is. Mm-hmm. And so we're trying to balance giving patients the appropriate time they need to feel heard and give all useful information, but also understand that other patients have to be seen. So we never want a patient to feel rushed, but we also want to be precise and gather information for that particular visit.
Yes, gotcha. All right, looking through these, another question from Miss Angela is, for you in your practice, do you perform a cervical ablation?
Yes. So in my practice, I do ablations for joints and spine problems. So we perform cervical, thoracic, lumbar, sacral, shoulder, hip, knee ablations, and then we also do specific type of injection management first. And so usually you can expedite that by seeing a physiatrist before seeing a spine surgeon.
No sound. Are we good now? Okay. Do we have sound?
I think we're back.
Okay. Sorry, the weather, there's like a whole thunderstorm outside right now.
Yeah, so I'll reiterate, it's a period we lost some sound. So what was missed was, the question was, do you need to see a spine surgeon or a physiatrist in any particular order? And so the answer is, it would be ideal to see the physiatrist first because they're the gatekeepers. Most of the conservative care is performed by the physiatrist, so including ordering therapy, doing injection management. And if you see the spine surgeon, they're going to want the same conservative care first. Mm-hmm. So it'd be easier to see the physiatrist. However, the exceptions are if you have increased risk of permanent leg weakness or bowel or bladder changes that need surgery to have a good outcome, then a surgeon will be preferred. A physiatrist also can make that determination when they evaluate you and then immediately refer you to the surgeon. But it's ultimately up to the patient's choice.
Awesome, awesome. So can you tell us a little bit about your practice? I know you said you do ablations. What all treatments do you offer?
Yeah, so I tell my patients I do almost everything except headaches and feet and some other things, but we perform epidural management throughout the entire spine. We perform arthritic joint pain management to include the spine, upper back, low back, the tailbone, the hips, the SI joint, the knee joint, the shoulder joint. Mm-hmm. We perform ablations, which are to reduce joint pain. We do regional injections. We also do neuromodulation, which are spinal cord stimulators or peripheral stimulators. We perform orthobiologics. We do ultrasound guided procedures. We also do management of myofascial pain conditions, non-interventional management as well, to include monotherapy, so patients who get great relief with single medications is an option. Mm-hmm. We also offer physical therapy referrals, many things.
Awesome, awesome. So any patient can come and see you if they need you. Is there any other last things you want to add before we close out?
I think the biggest thing I would say that helps patients, if I was a patient, how I would want to be seen is obviously I'm coming to see you with a painful condition. I want to have it better, improved. Big thing to keep in mind is that sometimes we have to gauge our expectations, which is just have an open mind, just present what's the problem, and then discuss what's going on with the doctor, come up with a solution. Sometimes if we expect a certain thing, we may be disappointed. Not all conditions require injections or medications, and sometimes we may not prescribe anything because it's not necessary, it doesn't make a difference. Other times we will. And so I think just coming in with a specific complaint, a goal with the doctor, and then allow the doctor to gather information, do his exam, and then discuss with you what's going on. And then obviously communicate any concerns that you have. For me particularly, I don't like to recommend a lot. I like to give patients options. Very rarely do I recommend certain treatments. And so I want patients to have autonomy in what they choose to do. And so I also want to provide them with the information to make that decision. So that's kind of our practice.
Awesome, awesome. Well, thank you so much. If anybody has any additional questions, you can send them to the email that is on the page right now showing. Want to just thank everybody for watching and sticking with us throughout the storm that's happening outside. Thank you for watching. And then if you'd like to make an appointment with Dr. Abrams, you can do that. You'll see the information for that displayed momentarily, or any of our providers here at OrthoSouth. Next month, it will be the third Thursday of the month on August 21st. We'll have Dr. Shireliki on. He's one of our surgeons, and he will be discussing robotic spine surgery. So come back on for that. Again, thanks for joining, and thank you, Dr. Abrams.
Thank you.